think it's all set, ready to go, which is good. But Hema, why don't we start off by just like letting you introduce yourself? Maybe just tell us your name and like what level you are working at currently as a doctor, and then we can go from there.
Yeah. So hi, I'm Hema. I come originally from Mauritius, and I'm currently a PGY3. Just gotten my general registration, which is great.
That's awesome. That's awesome. And explain to people like what general registration actually means, because maybe some people don't understand that, like the different types of registration and what general actually means for people.
So as an IMG, obviously, when you start working in Australia, you have to be under supervision, depending on your level of experience. So once you apply to APRA, they would assess your previous experience and sort of get you a provisional registration if you've got AMC Part 1 and 2 done already. So you start with level 1 if you've not got a lot of experience back in your home country, or if you have a large gap. And then otherwise there's level 2 if you have recency of practice. So you basically have to work for about a year doing Gen Surg, Gen Med, and emergency medicine, and then after that you apply to APRA again, and then get general registration, which means that you don't have to be under supervision per se, and then you can actually work in any of the hospitals in Australia.
So yeah, got you. So what's APRA like? Like I think we as like local grads don't really have like a great deal of like involvement with APRA for like the different types of like AMC and everything like that. Like what's APRA for the IMG? Like what do IMGs need to know about APRA?
So it's the main governing body like for medical practitioners. So they would determine your registration. So you have to sort of apply for registration with them, and basically send them all your sort of certificates and everything. And they would, assess you as an IMG, assess your experience. And they've got a board meeting every month where they sort of assess you as an IMG to see whether you're qualified enough to work in Australia, and then they sort of grant you a different level of registration, and that's pretty much it.
Say you're an IMG and you're like deciding to come to Australia to work. How do you work out if you need to do the AMC Part 1 or the AMC Part 2 exam? And then how do you work out if you can go straight into like a general registration, or will you always have to have like this provisional period where like I don't know why. Did balloons just come on my skin? What the hell is that?
I don't know that's intentional or not.
Oh, did you give me balloons?
Yeah, I saw that.
How do you do that?
I have no idea. I didn't do anything, so it's probably on your
end. I thought you may have gifted me balloons.
No, I'm not touching the the screen.
Oh my god, what was the balloons? That was so random. What was I saying? So say let's go back to the start. You when you were like in Mauritius and you were like, I want to come to Australia to work as a doctor, what like how did you go about deciding if you need to do like AMC Part 1 or Part 2, and what's that whole process like? Because could you even go straight into general registration, or would you always need to have a period of observation?
So it does depend on which country you're from. You've got different pathways for IMGs. One is the most common one is obviously the standard pathway where when you come to Australia, you have to do AMC Part 1, which is sort of the MCQ exam, and then go into AMC Part 2, which is the OSCE. And once you've done that, and you have a job offer, then you can apply for provisional registration with APRA. if you only have AMC Part 1, but you have managed to secure a job offer in Australia, then you go on limited registration. You obviously have to do AMC Part 2 in the first 3 years of you working, and then you go to general registration after that.
So if you don't do that AMC Part 2 exam and pass it within the first 3 years, then what, Australia say, hey, it's been a good time, but you can't work here anymore as a doctor? Is that what they say?
So you obviously, you can't, when you have limited registration, you can only renew it for 3 years. So you have to renew your limited registration every year. So you can only do that for the first 3 years. And after that, they would tell you that you have to have AMC Part 2. Otherwise, you have to find sort of a work-based placement, like school work-based assessment, which means that you find a hospital which sort of offers this work-based assessment, which means that you don't have to do Part 2, but they assess you while you're working to see whether you can be granted general registration. You can't work is basically what they tell you. So
got you. So say you like have a few cracks at the AMC Part 2 exam, you're unsuccessful, and then you explore that idea of doing workplace-based assessment. If they deem you like clinically, at the clinically at the right standard to like work at as a doctor, then they like the assessors at the hospital. There might be like a consultant or like a senior registrar, probably a consultant, right, who would assess you and then make that decision that they think that you're appropriate to work in the workforce, and then that acts as like a substitute for the AMC Part 2. Is that right?
Yeah, that's what the idea is. But not all hospitals have this sort of workplace-based assessment. It's just few hospitals. Obviously, given that there's a lot of IMGs wanting to sort of secure those positions, which is very, very competitive.
Because obviously, if they don't have one of those hospitals, or like say they're working in Australia, they've tried the AMC Part 2 for a few times, they've reached their 3-year limit, and then they're actually not at one of those hospitals that offer the workplace-based assessment, then they're really stuck, right?
Yeah, that's the worst part. You can't. Yeah, they would not renew your registration any further, and you probably you cannot work. So it makes it.
Are there many people in that sort of situation, or?
Not that I've heard of, but then again, I don't know many IMGs. I just know the ones that I work with, and most of them have managed to sort of pass the AMC Part 2.
Yeah, got you. Because I was going to say, I mean, obviously, we've worked together in the first part of this year. There's a lot of IMGs who we work with who are not in your position. Like your position is you've passed the AMC Part 1 and 2, and now you have general registration. But there's some people who have only passed AMC Part 1, right? So how have they gone at, like, in terms of getting a job, do you need to pass the AMC Part 1 in order to have a job at all in Australia? Or can you?
Yeah, that's right. You cannot work without AMC Part 1. So that's the basic minimum that you need to have is Part 1.
Got you. And do you have to sit that sort of test in Australia, or can you sit it in your home country?
Yeah, I think they do have different centers in different countries. If you go on the APRA website, you would find a list of those countries and have the dates by which you can apply for, and the dates of the actual exams and the dates the results are released. But for me, because I came from Mauritius, I had to come to Australia to do AMC Part 1. Because they didn't have any centers in Mauritius, obviously. I didn't mind when I had to come here to do the exams.
Fair. Where would the closest center be for you if you?
Would be South Africa.
Okay, fair.
But I still had to take a plane to go there, so it was easier to come here, I guess.
It doesn't make sense that it's not available to be done online. I mean, I feel like in this day and age, why would you only have certain centers that could do it? Why not just do it online? I don't know.
Yeah, correct. Now that they've got AMC Part 2 being online, I think they may consider AMC Part 1, being online as well. I think that would make it easier for a lot of IMGs.
That's almost counterintuitive, right? Because AMC Part 1, I mean, we don't, as local grads, we sit a version of the AMC, but it's actually different to the one that you guys sit, which is, yeah, a little bit of an interesting situation. I feel like you guys might have it might be a bit frustrating for you that we seem to sit this exam or this version of the AMC in our final year of medical school that is much easier than the AMC exam that you guys have to sit as IMGs. But yeah, so the AMC Part 1 exam is a multiple choice exam, correct?
Yeah, that's a multiple choice. And obviously it's a bit different just because it's based on Australian medicine, if that makes sense. Sort of the questions wouldn't be straightforward, and they would ask you, okay, what's the out of those choices, what's the best management sort of or first line of treatment for this patient? And all the 4 answers would be correct, because obviously when a patient comes to you, you wouldn't start with one. You probably would do a lot of investigations at the same time. And yeah, so that was the hardest bit, because all the 4 answers are correct. You just don't know which one would be the first, sort of treatment of choice, given that it differs from country to country. I mean, in my country, if you come in, we will probably just order all the investigations instead of having to do just one and then make you wait, and then, if that makes sense. So that was the hardest bit.
That's really tricky. That's really tricky. So when did you, let's go back to like when you were back in Mauritius, like you were working as a doctor there, right? Before you decided to come to Australia. How was that?
So when I finished my medical studies, I had to wait for a year before getting into internship, because that was the way it was, and not everyone could get in unless the government gives you a job there. Obviously, it's based on our finances as well. We are a very small island, so I had to wait a year, and then eventually got into internship. And at the end of the internship, the waiting started again, because you can't work as a resident unless they give you a job, and you basically don't know when the job offers would come through. So I was thinking about different options where I could go to sort of, and the other thing is you can't specialize in Mauritius. You have to stay as a resident for your entire life, unless you go out sort of overseas and specialize and come back. So obviously this made me start to think about other options. And given my sister was already in Australia and my partner was here as well, I was like, well, that's a very good choice. So then, I started sort of researching about the ways to practice here. It wasn't very straightforward, given that the AMC website, sort of the APRA website, doesn't give you a lot of information onto how to get into the system. But I didn't know anybody from Mauritius who actually got through into the system here, which made it more difficult. But yeah, I sort of researched and saw that, that you eventually have to do AMC Part 1, and then I started studying for it with the minimal resources that I had. But I think Facebook was one of the best resources, as surprising as it may sound, because a lot of IMGs, what they did was they did like a Facebook group where they would sort of study together and provide you with a lot more resources than the official website. So so this is where I started from, basically.
That's pretty crazy. So like, I mean, a lot of things to address there, but like, I guess let's go back to like when you finished medical school, there is like not a job for everyone. Like I know when we finished medical school, everyone's guaranteed to get a job. Like there are positions for everyone. There's like no one who finishes medical school as a local graduate who doesn't get an internship spot if they want one. I mean, only if they defer would they not have to work as an intern straight away.
Exactly.
So what proportion of people is like were in your boat where you had to wait for a job?
Well, all of my batchmates, we didn't get a job because there were no jobs to apply to. So first of all, we're a very small island. It's just 5 hospitals, and obviously they do need doctors, but the barrier is the finances. So they don't have enough money to sort of support and fund all these doctors coming into internship. Because as an intern, we used to get paid like a stipend, not much, but just a small amount of money. But it was still a cost for the government. So they would probably just take doctors maybe every 2 years or so. And I had to wait for a year and a half before getting into internship. So you're here basically without a job, and you cannot work as a doctor because you've studied 5 years to become a doctor and there's no job. So, what do? So that was, it's kind of very hard. And then they decided to implement the idea of doing an exam before internship. So even though you've already graduated from medical school, after a year and a half, they realized, okay, let's put in sort of an entry exams to internship. So that, it was sort of a news to us because we were the first batch to have experienced such a thing. We didn't know what the exam was about, how it was and everything. I had to go through that and then got through internship.
Does that exam cost money as well?
Oh, yeah, it does.
It's another way for the government to, not give you a job, but also take more of your money.
Exactly, because not everybody did get through in the first attempt. Eventually
that's really interesting that like you don't have a job waiting for you at the end of medical school. And then you work for a year, and then did you have to wait around for another little bit before you did your next bit as a resident?
Yeah, so at the end of internship, you have to do another formal exam, even though you are subjected to a lot of exams throughout internship. We had to wait for 3 months after internship to sit for the final exam. And then once you're done with that, you have general registration. But then again, you don't have a job as a resident into the public hospitals. You do have few clinics that do take a small amount of doctors. So there was that option. Or you can practice privately. That's one option in Mauritius, where you can open your own sort of clinic or room where you have a few patients that come through. This is what I did, like practice privately. And because I was studying anyway for the EMC, so I was like, that's good enough.
At least you can, it's a good way to supplement the income whilst you're studying, and you're spending a lot of time studying. You need to have some income if you're not working as a full-time doctor. So
the good thing is in Mauritius, you do have the support of your parents. So a lot of us, we just live with our parents, so don't have to pay rent and food and everything. So that was good because obviously you don't get a lot of money being a new doctor and then opening your own private practice. It's hard. That's one of the options. So
you mentioned one thing, that the specialists are like, you can't specialize in Mauritius. So the specialists that work in Mauritius, from Mauritius, they just specialize elsewhere and then come back to Mauritius.
That's the way it is. Otherwise, you just stay as a sort of rotational RMO throughout your life. In Mauritius. You just jump from departments and there's no sort of registrar or senior resident or anything. It's just you stay as a resident, and then you've got the consultants who obviously go overseas, specialize, and come back.
I don't know. I mean, that's still a possibility here. You don't have to specialize. It's not like you get matched into a program and you have to do that. I mean, it's not as satisfying, I don't think. I think everyone sort of wants to go into a particular field and then get really good at that and eventually become a consultant. But that's interesting that you have to go outside of like where you like grew up to specialize and then come back. That's interesting. But like when you decided that you were gonna come to Australia, your partner was already over here, and then you decided to come on over and then sit the AMC here.
Yeah, so I actually came here on holidays when medical school ended to visit my sister. I actually didn't quite like it at that stage. So even though my partner was here, I was like, and indecisive about whether I should come here, given I had a good experience the first time. I mean, not a bad experience, just that it was very different when you come here as a visitor. It's
Of course.
yeah. I mean, if it's coming from a tropical island where it's like sunny and 25 degrees all the time to coming here to Melbourne was very different. So I was still thinking about whether I should, because once you get into AMC, it's an expensive process, and obviously you have to stay here. So it's a sort of a lifetime commitment, I might say. So I was thinking about it. But I guess then my mom decided to sort of come to Australia, join my sister. So it made it pretty easy then, because my sort of entire family was here. So I was like, yeah, why not give it a shot? And yeah, this is where I got into AMC.
And what is the AMC? If someone's listening to this and they have no idea what the AMC is, part 1, part 2, do you want to give like a brief overview of like what that is?
Yeah, so AMC, obviously Australian Medical Council exams. You've got a part 1 where it's the MCQ. I believe it's a long time ago that I did it, but I believe there's 150 questions. I'm not really sure about the passing rate. I mean, the passing rate though. Obviously, if you study for it, it's sort of easier to get through that AMC part 2. So the part 2 is the OSCE wire, where you have, I think, 20 stations, and you have, I think, the AMC, where the council has just reduced the passing rate. So you had to get 10 stations out of 14 to get a pass, but now it's 9 out of 14 stations, so that's good.
Yeah, I've heard like pretty horrendous stories from other colleagues that I've worked with who have had a few attempts at sitting the AMC part 2 mainly. I think the part 1 is okay from anecdotal evidence. Obviously we sit a different AMC exam, which essentially everyone passes, but for IMGs, it's a different exam. I think the pass rate, actually, I'm not going to quote numbers, but it's pretty good for the part 1. But part 2, I mean, I've heard of sort of percents around 25, 30% pass. Like,
I think it's more like 18 probably now.
Really?
When I started, it was 20%, and I was like, wow.
So 20% of the people who go to sit the exam will pass, and the rest, like the 80% left over, don't, which is unbelievable.
For an exam, yeah. So it does show that it's probably one of the hardest exams out there. You won't have, obviously, when we as an IMG come to a different country, we would study very hard for the exam. It doesn't show that, we are unprepared or this is why we are failing. It's, I think it's probably just the format of the exam. Like, they give you 8 minutes to get in and do all the tasks that they've asked you. And sometimes they would ask you to speak to the patient, to get a history, do the exam, give the diagnosis, and explain everything in 8 minutes. And for people who struggle with English, it's very, very hard. Like, if you don't finish within 8 minutes, it's a fail. If you speak too quickly and the patient doesn't understand, or it's a fail. So I think it's the format of the exam as well is sort of not in favor of IMGs, because not everyone, my first language is not English. And a lot of people do struggle with English. Obviously, I had so I grew up in Mauritius, where we speak French, but also English. So it was sort of easier in a way. But yeah, there are a lot of people who would struggle with English, and getting all this tasks done in 8 minutes is almost impossible. So it doesn't show you how good the IMG is. It doesn't show you how prepared he is. I guess that's my sort of point of view.
No, I agree. I think from a local grad's perspective, it's almost frustrating that it's not applied universally. Like when I talk to people in your situation who have gone through this, it's like, well, it's all well and good to have like an exam, but I mean, why is only certain people examined and not others? Because I would probably challenge the local grad cohort. Like, I don't know if they would all pass it, like if if the original point of this exam for the AMC part 1 and part 2 is to, make everyone on a level playing field from, like if they don't have the same level of education as Australia or something. I don't know what the premise is for doing it. I think potentially that is, and it's to make sure that everyone, when they come to Australia, is working at the same level. I don't think local grads could pass this AMC part 1 or 2 exam, so
yeah.
like even English.
So this is why they probably need to review the format. I mean, especially the timing. Even I struggled to finish stations in 8 minutes. Like, well, I'm working as a doctor now, and there's no way I can see a patient in 8 minutes. And I usually take 20 or 15 is the least amount of time. But 8 minutes, I mean, that doesn't show you real life. So why implement it in an exam? I do understand that they, can't be so liberal on time, like give an IMG like 20 minutes to examine a patient, but still, it is a little bit tight.
It is. And I think that if you were to have an exam, that's fine, but maybe make everyone do it. So before they start work as a first year doctor, as an intern, maybe everyone has to sit the same AMC exam, IMG or local grad.
True. If their aim is to get everyone to be on the same level, then why not do everybody do the same exams? That would make more sense, I guess. And this way they would be able to to assess.
Because I think I remember like stressing a little bit in final year med school for this AMC exam, which they were saying, and there were some practice questions. I don't know if they're online or someone shared them, but I was like, these are really hard, like I haven't studied that much. And then when I got into the to our version of the AMC exam, I was like, oh no, these are super easy. What was I worried about? And then I did some digging, and there's like obviously a massive difference between the exam we sit versus the exam that IMG sit. But you mentioned like Facebook as being like one of the best resources to study for these sorts of things. What were there like resources online or like textbooks, or did someone just post questions, or what's the go?
So AMC does give you like a handbook, which is several years old, but they just show you sort of they give you an idea about the sort of questions that can come in the exam, and when you go to actually do the exam, they make you sign a disclaimer, sort of like an agreement with that you cannot share those questions outside, like on social media, or you can't speak to anybody about the questions. So we're sort of limited there, but some people, well, they do share it on social media, and this is how most of the IMGs get information, because there's no textbooks, there's nothing that can prepare you for AMC Part 2. Really, the book doesn't. It's, as I said, it's several years old, so it doesn't reflect the present format of the exams. Like, you wouldn't have questions coming from that handbook. So yeah, and as an IMG, you probably need more resources than that.
But part 1, the handbook, is like the textbook that you study, and then multiple choice questions are based sort of off that. Is that the general vibe, or is that not it?
So The handbook is for the part 2.
Okay.
Yeah, part 1 you do have like a trial exam on the AMC website. As far as I do know there's no handbook for part 1. I'm sorry if I'm saying the wrong thing, but I couldn't find one. I did a trial exam on the AMC website, like the official website. That's basically the resource that you have. Not sure if there's a handbook though. Probably have to double check that. Sorry, it's been several years that I did AMC part 1, so it's a bit harder for me to remember.
No, I'm just like super interested because I'm like, well, this must be like so overwhelming for someone who like wants to come over and work in Australia. They don't know any other like IMGs. They have to sort of fend for themselves. The website and sort of general direction is pretty vague. But you know you have to pass this exam, and it's like, well, how do I go about this?
Yeah, the study process is hard as well because you don't have any pointers towards, how do you study for that exam? Because you obviously can go and read all the books that you want, but having sort of a direction would be great. Like, what are we expecting when you go and sit for the exam? What sort of questions? That would be great. But part 1 was an all right exam for me. It was just, I think, part 2 that was the hardest bit.
Fair enough.
Yeah, and getting a date, obviously, for me, I came right before COVID, so getting a date for the exam was the second hardest thing. Because there was no dates. There were no dates, and I couldn't work. I couldn't work as a doctor without
after you passed the AMC part 1. Did you start working, or did you wait until part 2 was finished before? Because obviously in COVID times, right?
Yeah, so COVID times, I couldn't do part 1. So it took me around a year to finally get a date because when I got a date, I was fully prepared. I got an email so the night before, saying that somebody got COVID into that center and they would close it for a day. And I was like, they closed it for just the day I was about to sit for the exam and reopened it the next. So that was hard. They did that almost every month until for a year I could not find any dates. So obviously it took me a year to sit for AMC part 1. Now I've been in Australia. I had at that point been in Australia for about a year and a half, so I didn't have recency of practice, and finding a job was very, very hard for me. I tried applying to so many hospitals, but it was very hard given that in Mauritius as well, I wasn't sort of working in a public hospital for about 3 to 6 months, and they counted that as not practicing, even though I had sort of my own private practice, if that made sense. So at that point, the hospital would be like, you've got like a 2-year gap. So I couldn't find a job. So my only option was to do AMC part 2 because then I had stronger chance of getting a job. So then again, at that point, we were I was in Melbourne, which had the strictest lockdown ever in the whole world. So they were not doing AMC part 2. There was no dates at all. And then finally did start the online format. They had a huge backlog of people waiting for it. So they prioritized those people. So it gave them dates first. And then finally after 4 years is when I could finish part 2. And then I applied for a job and I got it, which was sort of last year. So that was struggle.
That seems like a long road, and very frustrating that due to like this delay from like COVID and everything, that your experience back in Mauritius was like deemed invalid, for like clinical experience, and you were forced to go down the AMC part 2 route before you could actually get a job. Whereas a lot of people that I know we work with now have only sat the AMC part 1 and they haven't even sat the part 2. So
yeah. And I was like, oh, maybe I'm just unlucky. I don't know. Oh, maybe it was just the wrong time. It was COVID.
And so just with like that recency of practice thing, like how is it is it automatically like after 2 years, if you haven't worked as a doctor, then they don't really count anything? Or is if you've had a fair few years beforehand, then even if you like worked at like a resident level or something for maybe 3 or 4 years before, but then took a 2-year gap, like, is there any like strict guidelines, or is it just case by case?
I think just case by case. It depends on the hospital, really, but I didn't have much experience. I had just finished internship, so obviously I was not the favorite of the applicants when I applied for jobs. But I think having like a fair few years of experience and having sort of a gap of 2 years might still be okay. But anything for like longer than that is not sort of viewed very favorably by the hospitals. But then again, it does depend on the hospital as well. Like when I applied at that point, when I got a job, I had a 4-year gap already. And the hospital, so I worked in Alice Springs, and they were the first one who gave me a chance, which I'm very, very grateful for. But yeah, I think it does depend. It's a case by case basis, really.
And so that was last year, right? You worked in Alice Springs, and how was that?
Maine. It was great. It was great. I mean, the moment I got a call, because it was the first hospital that called me back, and I was very, very thrilled, because then I started researching about, if you get a call for an interview, how likely are you to get actually the job? And a lot of people told me that, if you've got a call for an interview, it's almost sure shot that you're going to get in. And obviously that meant me moving from Melbourne to Alice Springs, a place I've never been. It was scary, but at the same time very exciting, because it would be my first job as a doctor, and that would mean having residency of practice, which is great. So yeah, I did the interview with the director of clinical training, and after 2 days I got a call that I got the job, which is great. Then started the process of me having to apply to APRA for a provisional registration, which means that they would ask for a lot of documents, and it does take a while between application to granting of the registration. It took me probably about 2 months, but the hospital was kind enough to wait until I've got the registration, and then I got my first job and then started working, which was great.
That's super exciting. And so provisional registration for an IMG is just 1 year, right? And then if that's all good, they sign off, you do like your assessments, then you can apply for general registration. And then presumably that just goes through straight away, right?
Yeah, so provisional is obviously when you've done part 1 and part 2, and then you have to at least have rotations in general medicine for about 10 weeks, a general surgery for 10 weeks, and emergency medicine for 8 weeks. And every 3 months, you have to send a report to APRA about how it's called a work performance report, where the consultants they would have a chat with you, and then fill out the form saying if you're performing up to the level or not. So every 3 months you have to send that report to APRA. And then at the end, the hospital that you're working at, they have to give you like a letter of recommendation saying that you've worked in all those 3 departments and you have performed up to a level of an Australian graduate. And then, it took me about 2 weeks. It was sort of pretty straightforward, given that I had supplied all the right paperwork. So, got it in 2 weeks, which is great.
Fair enough. And because, I mean, we have a similar sort of thing where as a first-year doctor, we have a provisional registration. And we have to do like, those rotations in like a medical rotation, an emergency department rotation, a surgical, and then get our assessments at the end of term, ticked off. And then essentially, if that's okay, you can apply for general registration, which is what I have now. But yeah, that's interesting. So it's sort of a similar like first year doctor vibe for provisional registration as an IMG. I don't know if you Yeah, I don't know if you know much about like Observership. I was doing like a little bit of reading about it on the APRA website, and a couple of people have like messaged me about Observership, and I actually have no idea what it means. But do you have you come across that or had to do that? Or?
I did come across that when I was working at Northern Hospital, but not as a doctor. I was working as a public health officer. At that point, I saw a job sort of advert at Northern Health for Observership. It's basically sort of like few weeks where you work at the hospital as an observer, but you're not meant to, you can't take any clinical decisions, you can't chart medications, you basically can't do anything, but what you do is basically observe other doctors doing their day-to-day activities basically in the hospital. There's a cost associated with it because you have to pay the hospital to be able to be there as an observer. And minimal, so all the hospitals do require you to have AMC Part 1. It's favorable if you've got Part 2 and recency of practice, but AMC Part 1 is the basic minimum that you need to have to be even eligible for the program. And yeah, having this is sort of a good thing in your CV because a lot of hospitals do see that, okay, you've done observership, so you're sort of familiar with the Australian medical system. So it's going to be easier for you to integrate, into a job, sort of.
Yeah, so it's sort of like work experience that you pay the hospital for, and then what at the end of it you get like some sort of certificate that says,
correct,
"Hey, I've completed observership."
Yeah, but I didn't get into an observership really. Because there was no, again, COVID time. So a lot of hospitals were sort of not, well, most of them were not, giving observership, offers. So.
Got you. What's the cost associated with doing this observership, and how long does it last?
Well, that's going to be hard for me to say. I'm not too sure, but it's several $1,000, several. Yeah. I'm not sure about the exact cost, but yeah. And I think it's for about 10 to 12 weeks, if I'm not wrong. But then again, don't quote me on that. Yeah. Given that I didn't have the opportunity to do an observership, I don't know much about it. But yeah,
gotcha.
What I know is that it's a good experience.
It's a pretty lengthy period of time, potentially like 3 months. You have to pay them a couple of grand to actually sit it.
Yeah, it's full time, so you can't work while doing an observership as well. So, when I saw, so I was working at Northern Health at that point, and I already had secured my sort of job at Alice Springs, and this is when I saw the advert come through, and I was like, wow, that's a bit harsh that you have to pay and then you're full time at the hospital, but then this means that you can't basically work for that period of time, and Australia is expensive for a person not to be working. So it was, it's definitely
exactly. Is it much like, I don't know if you've heard of anyone or spoken to anyone who's done an observership, does it actually affect like their ability to get jobs in the future, or is it just a bit of a rort, or what's the go?
I guess it's viewed as a positive experience. It's a good thing to have in your CV, but I wouldn't say that would be a determining point if you don't have it. I think having AMC Part 1 and 2 specifically is the most important thing to have. If you quote me as an example, I had a 4-year gap and I still managed to secure a job, and I didn't have observerships or anything. So yeah, a good thing, but not. It doesn't matter if you don't have it.
I get you.
And for an IMG, I think if you do it, it's good in a way that you can have a sense of what's happening at the hospital, how the hospital works, and all the stuff. But I think the staff at the hospital themselves, they're very supportive. When I started, even the interns were so nice to me that they showed me everything, literally, how the system works, and because it's very different. All the things are different. Like even cannulas are different from Mauritius, and I didn't know how to use one because ours was simple, the butterfly one. So it was very different when, so you have to get used to everything. Obviously, if you do an observership, basically you can see how all the things work. But if you don't, that doesn't matter because you have very supportive like interns, registrars, other colleagues, and they would be more than happy to show you in the first few days how it works. And you're not expected to sort of, again, depends on the hospital, but you're not expected to know everything on the first day. And they were very lenient to me. Like in the first 2 weeks, they wanted me to be familiar with everything before, so I had very, very nice people that I was working with. So it made it easier.
Yeah, that's good. Have you like found like the overall like experience of coming from like Mauritius to Australia, to work as a doctor? Has it been like a tedious experience? Could it have been easier? Or like for sure it could have been easier, but like how have you found like the overall process? Like would you recommend it to someone who's thinking about, moving from their home country to somewhere else to work as a doctor?
Yeah, I guess if I had to do it again, I would definitely do it just because I'm quite happy with, how things have panned out for me. It was very hard. Obviously, it would have been easier if COVID wasn't there in the first place. But I think finding the right supports, a lot of IMGs are very, very happy to help other people. If somebody comes, to me and asks me for resources, I'm more than happy to help anybody. I've had friends at the hospital that I'm working at going to sit the part 2, and I'm like, and I told my friend, I have all those resources. I have papers that I have notes and everything. I'm more than happy to give it out to people who needs it, because I think that makes a huge difference, because you do spend a lot of time trying to find resources in the first place. So if you have that, I think it makes it easier for anybody to sit the exam. But yeah, I would definitely recommend anybody thinking about working in Australia to come through. We have lovely people, working. Everybody that I have worked with have supported me in so many ways that I'm very grateful for. And I sort of liking the experience and becoming a better doctor than I was probably like 2 years, maybe 4 years ago. I'm learning a lot of things, and Australia is great to live in. You have a lot of opportunities. You can specialize, so definitely would recommend anybody thinking about it to come through, and that would be a good experience.
For sure, that's really awesome. I guess if you were and like, correct me if I'm wrong, but you want to do medical as well. You want to go into like the sort of BPT, like physician's training and everything like that.
Yeah.
Have you sort of like started thinking about how you get on and do that sort of stuff? Or like, because now with general registration, you can start pretty much doing like BPT 1, right? Your basic physician's training year 1. Is that something you want to do like next year, or?
Yeah, so I've researched it a little bit, and there's a body called the PMCV, which is a postgraduate medical. I forgot the rest, but they basically, what they do is they open matches every sort of year, and for BPT it's in June. So I've been looking at preparing my CV, getting references, and then once it's opened, I will definitely apply for the match, hoping for the best. And so it means hopefully if I get into a training position, then I can start from next year, given that I have general registration now. So hoping for the best.
That's super exciting. Is there a specific area you're thinking about, or?
I was initially thinking cardiology, but we'll see how we go. I think the good thing about BPT is that you can do BPT part 1, 2, and 3, and then decide onto the advanced training, like what sort of pathway you want to take, whether it's going to be general medicine itself, or cardiology, or endocrinology. I haven't really thought about it. My probably aim is just to get into BPT 1 for now, just
Fair.
stepping stone, and then we'll think about the rest after.
100%. Well, I mean, June's just around the corner. So best of luck for that match. Hopefully you get a BPT 1 position, and then you can, start studying for that BPT exam. I don't know when people usually sit it. I'm pretty sure BPT 2 or 3.
BPT 2, yeah.
Okay.
Had a lot of people say it's BPT 2, yes.
Yeah.
But
And then
I'm
after
just
that,
enjoying the time where I don't have any exams for now. And then when I have the pressure, then I definitely would, start studying for BPT exams. But yeah.
I've heard that you do like sort of similar for most specialties, but there's like this written exam or like a multiple choice exam. That's the exam you sit in BPT 2, and then there's a in-person like exam before you can actually say you've finished the program, right? Is that right?
Yeah.
Okay. Cool. Yeah, like just as easy as that. Yeah, just do the 2 exams and you're on. Oh, I feel like there's always exams in medicine, no matter what specialty you choose, whether it be ED or ICU or surge or BPT, whatever it is. There's always exams and fees and stuff to do. So
Yeah.
I guess if you were gonna give someone advice who was, say, in Mauritius or a different country, and they're thinking about coming over to Australia to work as a doctor, where would you sort of point them in? Like, what's the best sort of starting point or place to start to do some research, what it's like, to find out what you need to do, and if your experience or CVs or qualifications match up or are recognized, or if you need to do supplemental stuff. What would you say to sort of that person?
Obviously start from the official sort of AMC website. That's the best place. They do have like some resources that might get you started. Obviously finding somebody who's gone through that pathway would be a lot easier. We have a lot of like Facebook groups where you can actually find a lot of people willing to help. That would be great as well. Just start there, and then eventually you'd find a lot of people willing to help. Like as I said, if somebody wants me to help, I'm more than happy to do that as well. So yeah,
amazing. Well, I guess let's sort of wrap things up there. That's been super interesting to like hear how you've gone from all the way from Mauritius, sitting this AMC exams, coming and working as a doctor in Australia. I mean, it's a pretty cool story, especially coming over here before you even sat any of the exams that you need to work as a doctor. And that's sort of your specialty. That's your career direction that you chose going out of school and stuff. So that's such a cool story. So thanks for sharing that with me and with everyone. So yeah.
Thanks so much, Harry. Yes, it's been an interesting chat, just remembering whatever I went through to be here. But I think if you're hell bent on something, you would probably you definitely will get it. So yeah, my advice would be just trust yourself, and if I was able to do it, you would be too. So yeah.
That's cool. That's really motivational. Almost makes me want to sit all these AMC exams.
Well, you can give it a try. You've got trial exams tonight, Harry. You can definitely try.
Maybe I should try it out. I reckon I'd fail miserably at these AMC exams. No, thanks very much, Hema. It's been an awesome chat. But, appreciate it. Thanks very much.
All right. Thanks so much, Harry. Thank you.
All right, so that's the end of that conversation. If you want to be part of something like this, you think you have an interesting story in medicine to share, maybe it's how you got in, and maybe it's that you got on a different training program or you went through some adversity, that's something that you think you'd be interested in doing, then send me a message. The link will be in the description how you can get in touch. If you know someone else that's probably keen to share their story, or you think that they would be a great person to share on this, then definitely link them in and we can get them on. If you want to stick around, there's plenty of other videos on here to check out and keep you informed, keep you interested, and keep you learning more about medicine. So there you go. Otherwise, we'll see you next time. Bye.